My name's Ben Teeter. I have a master's and a PhD in pharmaceutical sciences with an emphasis on social and behavioral aspects of pharmacy practice. I'm an assistant professor in the Center for Implementation Research and the Department of Pharmacy Practice in the College of Pharmacy at UAMS. My field of research is implementation science. Implementation science is defined as the study of methods to promote the systematic uptake of research findings and other evidence-based practices into routine practice, and hence improve the quality and effectiveness of health services. We're in the middle of an opioid epidemic, and interventions to reduce risk of death from opioid overdose are greatly needed. Arkansas has the second highest rate of opioid prescribing in the nation. It's estimated that 500,000 Americans could die from opioid overdose in the next 10 years. When a person's overdosing, their breathing slows down and it can even stop, and that makes it really hard to wake them from that state. Naloxone is a drug that reverses the effects of opioids and allows the patient to breathe normally. Earlier this year, a law was passed in Arkansas that allows pharmacists to prescribe and dispense naloxone in community pharmacies to people who may be at risk for opioid overdose. So far, very few pharmacies are actually providing this service. Other states have already passed similar laws and have begun providing naloxone in community pharmacies. In Rhode Island, colleagues of ours at Brown University have created and tested different materials that encourage patients to approach their pharmacist and ask them about naloxone. They've agreed to share these materials with us, but we need to adapt them to make them fit with the needs of Arkansans before we implement them in pharmacies in Arkansas. So understanding what pharmacies need to be able to provide naloxone and what strategies can actually help them implement this new service is greatly needed. This is where our project will come in and help. This project could have a huge impact on reducing the risk of opioid overdose and increasing access to naloxone using community pharmacies. Pharmacies are highly accessible when compared to other healthcare settings because there's no need for appointments to talk to a pharmacist. They're open in the evenings and on weekends, and they're more likely to be located in rural areas than other healthcare settings. This is really important because much of Arkansas's population is rural, and research shows that more people die from opioid overdoses in rural areas compared to those that live in cities. By determining the materials and implementation strategies that work in pharmacies to provide naloxone, we can create a toolkit that can be used by pharmacies across the state to make sure that those who need naloxone are receiving it. Our partner for this project is Harps Pharmacies. They are a regional grocery chain that have around 30 pharmacies. With this project, we have two specific aims. First, we want to work with pharmacists, pharmacy staff, and patients to go over the materials that were used in that Brown University study and pick the parts that we think could be useful, and then also create the parts that we think are missing. We know from some of our previous work that pharmacists in Arkansas are interested in starting conversations with their patients about naloxone. Having this kind of conversation with patients can be really difficult. Figuring out an agreed upon way to do this needs to be established. Second, we want to take what we selected and created and then test it in 2 Harps pharmacies to see what works and what the pharmacy staff and the patients actually think about it. for the first specific aim, we're going to use an implementation science method called evidence-based quality improvement, or EBQI. This method has been successfully used by members of our research team and brings together clinicians, patients, administration, other stakeholders, and the research team to work together to come up with an evidence-based strategy to implement a new service or guideline. In this case, we're going to bring together the HARPS pharmacists, pharmacy staff members, patients, the pharmacy administrators, and our research team to form a group and work together to pick and develop the different materials and strategies to provide naloxone in HARPS pharmacies. The EBQI takes place over 4 sessions. In the first session, we'll talk about the materials that were used in the Brown University study, pick some of those that we think we should adapt, and decide what we think is missing from their study that could be useful in Arkansas. In the second session, we'll work together to identify why some of the things we want to do might be difficult, and then talk about different implementation strategies that have been shown to be helpful in those cases. In the third session, we'll all agree on the design of the materials, and then we'll decide which implementation strategies we actually want to use. Then the research team will take some time to create all of the materials that the group agreed on, and in the fourth session, we'll present those to the group where they can tell us what they think should be changed, and we'll receive final approval to actually test these strategies in the pharmacies. For the second specific aim, we're going to evaluate the materials and strategies that we developed on a number of implementation outcomes. We'll collect information from 4 HARPS pharmacies. 2 pharmacies are going to be the pharmacies that are actually testing the materials and the strategies, and then we'll have 2 pharmacies that are comparison pharmacies. We'll collect these data so that we can calculate the naloxone prescribing and dispensing rates at each pharmacy, and this will give us a good indicator of adoption of the materials and the strategies. Specifically, we want to see if there's a difference in the number of naloxone doses prescribed and dispensed to patients that are at high risk for overdose at the pharmacies that are testing the materials when compared to those that aren't. We'll also collect data by interview pharmacy staff as well as patients. For the pharmacy staff participating in the pilot test of these materials and strategies, the interview questions are going to focus on how the new materials and strategies fit within the workflow, what's going well and what isn't, and what they would like to change in the future. For the patient interviews, the questions are going to focus on how they felt about the interaction with the pharmacist, if they felt the tone of the conversation with the pharmacist was appropriate, and what they would recommend for improving these materials and strategies in the future. All of the interviews are going to be transcribed and analyzed by 2 members on the research team that are experts in interview data analysis. Success will be a set of materials and strategies that result in high naloxone dispensing rates and that pharmacies and pharmacy staff and patients think are appropriate and fit in the pharmacy setting. As with any implementation project where a new service is being tested that has never been done in a particular setting, there are going to be some challenges. Specifically for this project, we're testing an intervention that a pharmacist will have with patients that are at high risk for opioid overdose. This is a really difficult conversation to have because the pharmacist risks offending the patient. We plan to overcome this challenge by including patients in each step of the process, from the design of the materials to the evaluation of the intervention. And including this patient perspective will really help to ensure that the way the pharmacist approaches the patient and the content and the tone of the conversation is appropriate and not condescending or patronizing. So towards the end of this pilot project, we plan to write a grant application to the National Institute for Drug Abuse. We'll submit that in February of 2019, and And what we hope to do with that is to test these strategies and materials in lots of different kinds of pharmacies across multiple states. Thanks so much for taking the time to review our application.